Everyone. This webinar is fourth in of series which introduces this book, Lockdown Smart Government Solutions from South Asia. And what is this book about? We know that there are many things which are critical for service delivery: collection, monitoring, resource management, beneficiary feedback, currency, decision analytics, communication. Often we do not know to implement at scale within varied contexts, all the political economy challenges entails. Dr. Omar Saif, Chairman of Punjab Information Technology Board, knows how to implement things within the government context. He worked a lot on his work over the last years as the chairman of Punjab Information Technology Board to implement feedback, data collection, monitoring, resource management, and performance monitoring solutions. Umar Saif, been the chairman of Punjab Information Technology Board for a couple of years. Before that, a tenured professor at Lahore University of Management Sciences, PhD from Cambridge, and he has done postdoc work from uh, MIT. Also been awarded Sidara Imtiaz, Pakistan's highest civilian honor. Over to you, Umar Saif. We want to hear about all the smartphone, cell phone based performance monitoring innovations you have introduced in Punjab.
Zubair, do I start?
Do start.
Thank you, Zubair, for that very generous introduction. Let me start out by saying that most of the work that we're going to present today is largely based on using smartphones, low-cost smartphones within Government of Punjab in the last 3 to 4 years. And what is essentially inspired this talk is the uptake of this technology within the government. Really, in a developing world, in a public sector setting, technology takes off to a scale that it has using smartphones in Government of Punjab. And my favorite thing to say about Government of Punjab is that if Punjab was a country, it will be the ninth largest in the world population. 120 million people live in the province of Punjab. So it's a huge scale, and anything that we do typically it takes off at also a very, very large scale and impacts many processes and people that live in this province. Let me start out by saying how we got involved in using smartphones for monitoring government work. As I took up this job, I was a college professor before this. As I took up this job about 4 years ago, second into my job, and the first meeting that I went into was the 6 a.m. meeting that the chief minister was chairing daily, where all the secretaries were brought in, and each one was made to present work that they were doing to control or contain a huge dengue epidemic that had affected this province. In 2011, that's when I joined the government. About 21,000 people were affected by dengue, out of which 17,000 were from Lahore alone. And this was a pandemic by any scale. And the government just did not know how to cope with this. One, we didn't know clinically how to handle dengue patients. We didn't know what are the contributing factors. We didn't know where the outbreaks were. We didn't know how to contain these outbreaks, and so on and so forth. And in this pandemic, in a span of about 3 to 4 months with 21,000 patients, we lost 352 lives. And these are government reported figures, so the actual figures could be even higher. Given this, second day into my job, in this meeting with the chief minister, one of the presentations had a slideshow of pictures of the work that department had done a day before to avert the dengue epidemic. and one of the pictures did not have a timestamp. And the chief minister got very irate and said, "How can I be sure that this work was actually done yesterday, as you claim, and was done where you claim it was done, and was done by the person that you claim did this work?" And then pointed at us and said, "Can you devise a system through which I can monitor all the prevention or containment activities around dengue in this province, and I can verifiably see where the work was done, who did it, and where the work was done?" And this was and so this was the challenge that was given to us, and we came back literally overnight, developed an Android application. Android applications are easy to develop, and our strategy was to replace the digital cameras that these departments were using to photo log all the prevention activities that they were doing, and replace them with with cheap smartphones, Android phones, $100 phones, so that they can take pictures of the activities using these smartphones. And the application that we made, which was literally made overnight on borrowed cell phones, government procurement cycles take eons at times. So this was a donation by one of the cell phone companies, about 15 smartphones. And so we developed this application, literally overnight by pulling a nighter, which enabled you to do one simple thing. You would take a picture using your smartphone, using our application. The application would geotag the picture, and the picture would be submitted to our servers. Our servers would timestamp this picture, and you had to log into this application before you submitted this picture. So through this, we would find three critical pieces of information: where the work was done because the picture was geotagged, who did it because you had to log in, and where the work was done, and when the work was done, because our servers were time stamping the incoming pictures. So this is what we had. What you see on the screen is essentially progress from the first. We had a grand total of about 3 pictures. Well, people were already doing their work, so we asked them to take smartphones along and not take pictures using smartphones, etc. And this is the kind of uptake that we had for the first day. There were many little challenges also. This sounds deceptively simple, because in some areas you don't have good cell phone coverage. Our application would break down every so often. The camera didn't have autofocus, so the picture didn't come out well, etc., etc. But as we kept at it, improving the applications, the interface always remained simple. We translated the interface from an English one to an Urdu one, a localized interface. We replaced all the text with little icons, so even if you couldn't read and write, you could pick out the right icon of the activity that you want to report. And it was always, the core thing that you did with this application, the key thing that you did was to essentially take a picture. And as you took the picture, it got geotagged, and if there was no cell phone signal with a new improved application, it would store it locally on the cell phone and then automatically upload whenever it got connectivity. So you could go into small alleys and inside different houses and large buildings, etc. Cell phone signals or GPS signals were very weak. It would still record the information and upload whenever it got an opportunity. So as we got better at developing these applications, invested in more and more cell phones, and started rolling out these systems, this is what Lahore started to look like. Lahore had, what you could see on your screen now, there wasn't an inch of the city that was not covered with prevention activities. This actually is probably one hundredth of the data, one tenth of the data that is actually of the overall coverage of the dengue activities. And so actually if we loaded the entire data, the browser typically crashes. But this is a lot of data, and let me quantify how much data this is. This is about 4.6 million different pictures that got uploaded into the system using $100 smartphones. And these were field workers, about 3,000 to 4,000 of them, doing their prevention activities every day, taking pictures, our applications geotagging them, and then submitting them to our service. And 4.6 million of these pictures have been submitted to our system to date. So we progressively got good at identifying areas where we thought were ignored, didn't have sufficient coverage of prevention activities. And hence, the line manager, the district coordination officer, the EDO health, the concerned line managers could call someone up and say, you know what, I can see your activities on a map. Here is an area that I think hasn't been sufficiently covered by your containment activities. So I want someone to be sent out immediately to cover this area. And so this was a good sort of visual recognition, a quick recognition of where the work is focused and what areas have been ignored. And as we, as we started collecting this data, new requirements came up. One of the most exciting and challenging requirement was whether we can predict or at least uh, identify hotspots where the disease might spread into an epidemic. And therefore we included two more features in these smartphone applications. The first one was that while you're doing your prevention activities, if you do come across the Aedes aegypti larva, now this is the larva that then finally flourishes into a mosquito, which may or may not carry a dengue infection, but at the time the Aedes aegypti mosquito was infected with dengue. So if you come across that larva, geotag it separately. So as part of your prevention activities, if you're removing a water puddle or doing indoor surveillance or doing some chemical spray, if you do come across this specific larva, geotag it separately. Likewise, if a patient checks into a hospital and is diagnosed with dengue, someone would go to their house to do what is called an IRS spray, which is the indoor residual spray. It's a draconian spray to basically kill any semblance of a mosquito in that household and then the adjoining adjacent houses, so that the disease doesn't spread in that area. And while teams went out to do this IRS spray, we equipped them with smartphones also and asked them to geotag the houses of the confirmed patients. What you see on the screen is two interesting snippets of information. The red dots there are reports of positive dengue larva, and the circles are 1 kilometer radius around the house of a confirmed patient. Now, if you look at it closely, you will notice two important trends. The first one is that wherever there are more red pins, there are also more circles, which means that if you find the Aedes aegypti larva at some place in a neighborhood, you're likely to get patients coming through from that neighborhood also. And two, wherever you see one circle, you'll also see several other circles around it, which means that's an outbreak-oriented disease. If there's a mosquito infected in a neighborhood, it will not only affect one house, but several houses close by. So it's an outbreak-oriented disease, and therefore it's important to contain this outbreak before it develops into an epidemic. So what we wanted to develop was a system that, one, would let you pinpoint, localize an outbreak, identify it early based on presence of larva, because that's going to graduate into patients coming through from this area. And then once you've identified, localize this outbreak to contain it before it spreads into an epidemic. So based on this, we started developing an early epidemic warning system. This is actually very similar to a standard early epidemic warning system called SAT-SCAN. This was developed by CDC. Actually, it was developed at Harvard and now used by the Center for Disease Control in the US. It's a spatial temporal statistical scanner, which means that you give it the frequency of patients as well as their location. And in this system, our little tweak was to also include the frequency of larvae and their locations, as well as the environment parameters. So if the environment parameters are conducive, which is humidity, rain, and temperature, and you have the larva cross a certain threshold, and as soon as you get patients coming through, this system highlights that this is going to develop into an outbreak. And it has been, over time, this model has been very fine-tuned because of all the data that we've been collecting about, thousands of patients and millions of prevention activities. And this model, as I move the timeline at the bottom of the screen, you would see that it'll start spitting out outbreak alert. So the little circle that you see there is an outbreak alert, which warns you about a certain outbreak in a city. Now, the extent of the circle is the extent of the outbreak. The color of the circle typically is the intensity of the outbreak. Just because at this point in time, this is from this a few days ago, this little circle is because the weather is no longer conducive, and hence this is not colored red or orange, which would be more worrying. But we already have winter set in Lahore. As I scroll down the screen, you would notice that it also spits out the names of the UCs that are going to get affected by this by this outbreak. And this information is then sent out to the appropriate district coordination officers, UC, secretary, union councils, etc. These are district administration officers responsible for that union council. The black lines that you see are union council boundaries. So what happens now is that this system is receiving continuously lots of data about prevention activities, about lava reports, confirmed patient geotagged houses, as well as daily environment variables about rainfall, humidity, and temperature. And based on that, this model is making predictions on what may develop into an outbreak. And the idea is that if you look at an outbreak as sort of an inverted parabola, then you want to catch this outbreak as early as possible before it peaks. Because if it peaks, then it also spreads into an epidemic. So this model gives you about a 2-week heads up into something that's going to develop into an outbreak. And then the idea is to focus the containment activities around that area to contain that outbreak. Every time we've been able to apply this successfully, we've been able to contain the dengue. And wherever there have been lapses, we've failed to contain the dengue epidemic. The results of the system have been fantastic. From 21,000 patients in 2011 and 352 deaths, we have now come down to almost zero deaths in subsequent years, and only a few hundred patients every year across different cities. So this system has enabled us to hone on to hotspots of disease and eliminate and contain the disease before it spreads. As part of this tool, I started out by telling the story that the Chief Minister wanted a system developed where he could see where the work was done, when it was done, and who performed this work. Because the system now was getting all this information from smartphone applications, we developed a PowerPoint equivalent dashboard that the Chief Minister could use to view slideshows. So this is how it looks like. You see a picture on the map highlighted, that's a marker, as well as the picture and who did it and what activity was being performed, etc. So this is like a slideshow, I think, by the school education department. So as I move this slideshow along, you would see where the work was done on a map. You would see the picture of the work that was done. This was just awareness in school children about dengue, very important, as well as who did the work, etc. So that's the entire ensemble of what we developed using smartphones. And I've already told you that one, it has been successful in containing the dengue epidemic, and two, just the adoption of technology. About 4.6 million geotagged prevention activities submitted using low-cost smartphones in Punjab has been a success that at least I did not anticipate, entering into this kind of work. Now, my diagnosis of why the system took off to the point that it did at a scale that I did not anticipate when we were designing the system is because our weapon of choice was ideal for this kind of government intervention, which is a cheap smartphone. Historically, government would buy thousands of laptops and enterprise software, etc., for government departments. Typically, these computers are then pampered, put into air-conditioned rooms, but are used by your personal secretary because the government official either doesn't want a laptop on their desk or doesn't know how to use it, especially the senior level, secretaries in government departments. So one, the uptake was limited, and two, it required uninterrupted power supply, so that was an added hassle, not always worked out. It required an always-on network connection, which was equally difficult to procure and maintain, and three, they needed to be trained to use this. With a smartphone, it naturally handles all three challenges. There's a device that has some social value embedded in it. You can call your friends and family using this. Your children can play games using this device. So you'll probably keep it in your pocket rather than giving it to your assistant. It has a battery built in, so you no longer need to invest in a UPS and uninterrupted power. It has an always-on network connection, so that's already taken care of. And because it has a camera and a GPS, this becomes sort of the ideal device to roll out my monitoring interventions, which is what we've done subsequently. Moving on from dengue, we've then rolled it out for collecting information about our public health facilities, visits of government officials to different hospitals, different hospitals. These are visits of what we call EDOs, the executive district officer, the DDOs. All their visits are now monitored using smartphones. They report on presence of medical officers, the medicine inventory, how many patients were treated, etc. Using smartphones, we get all of that data from the trenches using smartphones. Every day, about thousands of phones are now used in the field. This is all data collected from different hospitals reporting important parameters that are then looked at by health officials. Likewise, all the drug inspectors carry smartphones. Their visits to different pharmacies, they're now mandated to carry smartphones and file compliance reports, which means whether this pharmacy carries has a valid license, whether it carries life-saving medicines, does it carry any expired medication, etc., are filed using smartphones. This is that drug inspection system. The different pins there are colored differently based on the kind of report coming in, and how many pharmacies were visited by an inspector, what the license number of that pharmacy is, whether they complied with all the government regulation or not, are now filed through smartphones. So one, they must go there. They can't really include, and three, the system, this data is fed to us in real time, so we can cross-verify and monitor this. And this is also being adopted quite effectively in the government. The next thing that I want to show has been a huge success over the last few months, which is a turnaround of the vaccination program. Let's move on to the next tab, and we'll come back to this in a second. What we've started to do with vaccinations, unfortunately, 85% of the world's polio cases now come from Pakistan, so it's a huge challenge for us. But also, a lot of disease burden in our health facilities is because our EPI program sort of fell through the cracks over the years. And Punjab employs about 3,700 vaccinators, and evidence is that they weren't doing a great job at what they were supposed to do. So we equipped these 3,700 vaccinators with smartphones and asked them to go check into kit stations. Now, these are places where they bring all these children to vaccinate them for the vaccination that they're due. And their attendance now is marked by their line manager clearly marking a daily route or a plan for them. These are different kit stations that this vaccinator is supposed to go to. And our application enables them to go check into this kit station. This application is designed very similarly to, let's say, Foursquare, where you go check into different places. So this application lets you check into a kit station. And you must check into all the kit stations that you're asked by your line manager before your attendance is successfully marked. Otherwise, you are marked as absent and your salary gets stopped. When we rolled this program out in October last year, we only had 21% attendance of our vaccinators. So clearly, this wasn't working out. And as we rolled this intervention out and started marking their attendance by mandating that they go check into all the kit stations that they were asked to, their attendance rose up to 91% in just 3 months, from October to January this year. And that program has basically gone through a total turnaround. And initially, we started out by asking them to check into kit stations. Now we ask them to also report on individual vaccinations. And when we asked them to do it upfront, the typical static friction was, well, we do a lot of work already. Now you want us to use smartphones to report this data. We don't have time for that. But as we rolled this out and started collecting data, we found that each vaccinator is vaccinating no more than 12 children per day. They can't, given the population growth rate. That's actually a statistical ceiling. And therefore, now they're mandated to also report on vaccinations. The second thing that we noticed, which is also equally interesting and a new application technology for us also, was that the line managers in this case, who were basically making a daily plan for vaccinators to go to different places, were also ignoring or erroneously overlooking localities that these vaccinators should go to, because there were a cluster of households there, but the line manager didn't mark that as a target for the vaccinator to go to. Hence, he didn't go there, and his attendance was marked, but some households and hence some children were left unattended. So we wanted to automate that process also. So what we've done is that we take Google satellite imagery, 3-meter resolution standard Google satellite imagery, and from that we automatically detect household clusters. A house from a 3-meter satellite imagery has a certain geometry to it. Typically, very squarish, looks like a house, like a contained polygon. So once you look at that satellite image, you can automatically identify clusters of households. And based on that, we basically overlay a layer of polygons, and you see several polygons on the map there. These polygons are basically clusters of households underneath, detected from Google satellite imagery. And the size of the polygon is the number of households in that satellite imagery. And once we figured that out and overlaid this layer of polygons on top of Google imagery, we then mandate that the number of check-ins and the number of vaccinations by the vaccinator must correspond with the population density, which is the number of households in that polygon. And if the check-ins do not correspond with the population density forecasted by the number of households detected by Google imagery, that polygon turns red. So now you'll see several polygons that have turned red because there are not enough vaccinations done there, whereas some polygons are green because sufficient number of check-ins or vaccination visits have happened in these neighborhoods. So therefore, this system is automatically identifying targets for vaccinators to go to, tracking the vaccinators using smartphones, now tracking individual vaccinations using geotag pictures of all the vaccinations that they do. We've also redesigned the vaccination cards in Punjab to carry NFC tags, NFC chips within the vaccination card, so that data can also be written and read out from these vaccinators. This is the kind of data that looks like what you see there. The table is the attendance of different vaccinators, and the program has really kind of gone through a sea change of 21% attendance to 91%, and several key antigens. Such as OPV3, which is the polio one, or pentavalent 4, which is a very, very important antigen at a certain age in children, has risen from 30 to 40% to 70%, which is the critical threshold beyond which the disease stops spreading. Having a 30% coverage of an antigen is not very useful because the disease still spreads. So there's a certain threshold and it's a function which you must hit before vaccination becomes truly effective in a community. And so that's the data that, that's the power of smartphone intervention that has turned that program around for vaccinations. I want to now move on to I want to skip over this and move on to a similar intervention in school education department that I'm very proud of, because we've also made this data public. So if anyone sees this talk, they could also, actually go to this website, open.punjab.gov.pk, and look at this data by themselves. It's actually open for everyone to see. Punjab, as I've said, is a huge province. We have 53,000 schools, about 52,000 schools in this province, out of which, and we employ about 321,000 teachers, and 10 million students go to these schools. The Government of Punjab rolled out a school monitoring program to make sure that the teachers are showing up, the students are enrolled, the facilities are in good order, the schools are clean, etc., etc. And historically, these are called MEAs, the monitoring evaluation assistants, on their motorbike would go from school to school, collect this data on a paper-based form, and then send it to the line manager, called the DMO, the district monitoring officer, who would collect this data, summarize it on the district level, and then send it to the provincial government, which would then further collect this data, summarize it, and then present it to the chief minister. The chief minister would look at this data every 8 weeks. We call it a stock take. This is actually assisted by McKinsey and DFID, and they look at this data independently, make reports based on this data, and present it to the chief minister. Now, there were, little problems in the way we were collecting data, and there were bigger problems in the way that would reflect in decision making. Even though we had a separate independent layer of monitoring, the MEAs who would go from school to school, they were collecting information on paper-based form. It was very tedious. It would take about 40 minutes to fill up this form. So there was inherent incentive for this MEA to ask the school teacher to fill up the form on his behalf, and to kind of fill up the form, and when he goes there, collect the form on his way and send it to the DMO. And two, the data was sort of going through several filters or summarizations, and people were uncomfortable on whether this data is then truly reflective of what was actually reported from the trenches, from the school itself, or did we lose some important detail in this summarization of data as it bubbled up from the school MEA all the way to the chief minister, and several filters and layers that it went through. And three, it would take weeks weeks for this data to be compiled and assembled at the provincial level for the chief minister to look at and make decisions. So we replaced the paper-based forms with computer tablets. These are 8 to 10,000 rupee computer tablets, and just slightly bigger real estate. And this is an expensive one, but they have about this is about $100 tablet, about a $120 tablet. We bought about 1,600 of these and gave it to the MEAs and asked them that whenever they go to school, they must fill up the form on the tablet itself. Now, this, though would seem, is sort of an additional chore for them to go and use technology and fill up this information. The good thing about this is because this is equipped with GPS and we already geotagged all the schools. When someone went to a school, based on their current location, we would pre-populate the form for them. So what used to take them about 40 minutes to fill up now came down to about 18 minutes because we don't need to change the district, the name of the school rarely gets changed. The enrollment changes rarely, the headmasters and teachers largely are the same, etc. So a lot of this information gets pre-populated, whereas he can then focus on reporting all the information that changes from between visit to visit. And hence they started reporting data through smartphones, so through these tablets. It took them about 18 minutes to do it. They no longer, each MEA had one tablet, so they couldn't give it to the school teacher to fill the data on their behalf. They really had to go there to fill up this data. And two, whatever they are now submitting is geotagged. We also ask them to take a selfie of themselves in front of the school as evidence that they actually went there, take a picture of the attendance register, take a picture of the school head teacher. We can click on explore here and then go to the actual map. So you'll see this map of schools of Punjab. So this is Punjab. And this is public data, so you could do this, in your time as well. So let's say we click on student attendance rather than teacher presence. So let's look at student attendance. The lighter color there is more incriminating, which means that the lighter colored districts are not doing as well as the dark ones are. So let's say that we click on one of the districts. Let's click on Rajanpur right in here. So let's click on that. And as we click on Rajanpur, now you'll see the 3 tehsils within Rajanpur. And we now click on the tehsil that is bringing the score down, which is Rojhan, which is the lowest scoring district. As we click on Rojhan, you would see all the schools in Rojhan. Now, this is the name of the schools, the unique IDs of the school, and the attendance in these schools. So there are certainly schools that have 100% attendance, but also schools, as we scroll down, and remember, we've made this data public, so this is great. Government is putting this pressure on itself. We're making this data public. As we scroll down quickly, we'll also notice schools that have 0% attendance. But let's go to a school that has, let's say, about 8% attendance, that GPS Bangla Hada. So let's say we click on that. And as we click on that, you'll see the actual form that got filled up by the MEA as he visited the school. So as we scroll down on this form, you'll see the name of the school. We have obfuscated the name of the MEA and his cell phone number, but I want to keep scrolling down this form. You will see different parameters that got filled up, and we keep scrolling down this form. You will also now notice pictures that I told you about. So there's this picture of the attendance register. We can click on that and make that big. That the picture of the attendance register. This is the picture of the head teacher. The picture of the head teacher. Then we click on the selfie of the MEA in front of the school as evidence that he went there. This is GPS tag, so he cannot forge this information. And then a proof of his visit, which is the signatures on the attendance register. So as we collect this data, and this school has 8% student attendance, not very good. All this data that's collected by the MEAs, you're looking at one of those forms which got submitted maybe a couple of days ago. This data, as soon as it goes live, all the parameters around districts and tehsils and markers and so on, all the other administrative units that we have in the government gets automatically populated. So no human is sitting down and manually summarizing this information. We're just getting these forms from the schools, and all of these parameters get computed automatically, as you've seen, and you can navigate this information and see all this that gets computed. So we can go back to the top screen now, and you will also see that the data that we made public also includes the annual performance parameters, the monthly parameters, as well as the 2014 school census data, which is the data that government fully owns. So this is sort of, actually sort of, making government data public making our data open for citizens to look at. What we've also done, and now let me come back to one of these forms that the MEA had filled. And as we come down, you would also notice that there's possible. Let's go back to the form that got filled. Maybe just back one stage back, and you would also notice that that there is now a little icon in the at the fourth column, fifth column maybe here, which is an opportunity for you to dispute this data. So even though we're making sure that the MEA is going to the school, and we're making sure that we're collecting this data from the trenches, and all the other KPIs get computed automatically, we also give citizens an opportunity to now come and register for an alert in this platform, get an SMS or an email as soon as a form for your village's school gets filled up. And you can come and cross-verify that form. And if you see that the MEA is lied in the information or has incorrectly reported information from a village school that you're aware of, you can come and dispute the data here on this website. And this generates an email for us to look at, and for us to then get back to the MEA and inform him that the people in the community actually do not think that this data accurately reflects your recent school visit. So this sort of is a two-way platform. One, we are collecting data using smartphones, making it public, empowering the local community to come and dispute this data, so that the data always truly reflects how well the public sector schools in Punjab are doing. I know I'm quickly running out of time, but I want to close off by telling you about two more interventions. This is closely tied to the school monitoring program that I just explained. MEAs go to the school, and we thought, while they're taking the tablets along, why not also ask them to quiz the students? The fact that the teacher is present in the class, the students are enrolled, they have access to the textbooks, we have running water in the tap, we have electricity, and so on and so forth. These are all inputs from the government. But the success of all of this depends on how much the student is learning, the student learning outcome. That's the output. So now we have equipped these tablets with an application, which is backed up by a very large item bank of questions about science, maths, language, which is English and Urdu in this case. And as the MEA goes to the school, it picks out a question randomly from this very large item bank of questions. So let's say an MEA goes to school and says, I'm here, give me a question for a grade 3 student for English vocabulary, or give me a question for math, arithmetics, addition. So you ask for that question as an MEA, and you pop the question on your tablet from this item bank of question, and this is thrown out randomly. So you can't prepare for this. And then he asks a student to answer that question on the spot. And hence we have this, with the spot visits, we have these spot quizzes institutionalized as part of these visits. So far, through these tablet-based forms, we've gotten close to about 2 forms that have been submitted. These are school visits. And we've had about 7 million quizzes that have been conducted. And this is the dashboard. That's the data that we get when a quiz is conducted. These are the questions that get thrown at the student. The question and maybe a picture, and they're asked to fill in the sentence, or they're asked to perform a mathematical an addition or a subtraction, a small mathematical problem. And as they answer that question gets GPS tagged, we know which school students are answering this question, and so on and so forth. And this is what we call the literacy numeracy drive. So we start getting this information. This is what that data looks like. So how does all the inputs from the government of that school compare with the student learning outcomes of the student? How well are the students doing in English? How well are the students doing in math and Urdu? And you can start comparing this across districts. And within English, how many students can distinguish between plural and singular? How many of them know how to use proverbs and pronouns and so on and so forth? What does their vocabulary looks like? How many of them are good at arithmetic? How many of them can do multiplication, addition, and subtraction, etc., etc. So all this data is now being compiled school-wise. And even though this might seem outlandish, but just equipping them with computer tablets, they've started to now submit, and 2 million of them, forms from the school's GPS tag, as well as a measurement of student learning outcomes from these schools. And we've had 7 million of these spot tests or spot quizzes administered in schools using the tablets that these MEAs were carrying. And for the first time, we have this very close, tight loop where the student learning outcomes are being fed back into the system. The readiness of the facilities, the presence of the teacher and students is being fed back into the system, and corrective actions are being taken every day rather than waiting for this data to flow down to the provincial government and the chief minister every few weeks. This data comes in real time. You can look at it yourself. The system automatically processes it, computes all these parameters, and if we find that the teacher presence or student attendance has fallen below a certain threshold, SMSs are automatically fired out to the concerned district officials, to the school headmaster, to the EDO, to secretary schools, to the DCO, informing them that something's gone wrong with the school because the teacher has not shown up in the last 3 visits. So that's our school education data. The final thing that I want to show you before I wrap up is crime maps. We've also been using smartphones for tracking patterns of crime. This madness typically has a method to it. Whenever a crime is typically planned, and there's always a pattern to it, and if you can decipher that pattern, you can prevent and contain crime. In several cities in Punjab now, we equipped each police station with a couple of smartphones, again, $100 smartphones. And I've asked them that whenever an FIR is lodged, whenever a crime report is lodged in the police station, the investigating officer drives out with a smartphone and takes a picture of the crime scene. And based on that information, we have started compiling patterns of where the crime hotspots or crime clusters are. So for instance, these are all the crimes that got reported in the city of Lahore. We've had 162,000 crimes geotagged so far. So let's say if we were to just look at motorbike snatching. Let me scroll down and see motorbike snatching. So if you just look at motorbike snatchings, these are the hotspots. These are the hotspots of motorbike snatchings in this area. And once you actually drill down and look at it a little more intelligently, you would see that these are places where there are also hiding places maybe close by, where once the motorbike is stolen, a motorbike can be hidden. If you look at all the cell phone snatching, it's typically in alleys at time of a day which are not well lit. So you just need to maybe put more lights there. If you're getting robbery or dacoities in a certain neighborhood, burglaries, you maybe need to change the patrolling police or maybe change the pickets to the police to stop that crime. And this is based on a very similar system developed by NYPD called CompStats. That also works very similarly. This is like a home-brewed version of CompStats, where we are detecting crime patterns and then feeding that back to police so that they can change their policing patterns based on this. This is the kind of insights you can get out of a system like this. So, what crime has happened in what police station boundary. If you, for instance, just looked at the crime of the time of the day where the crime goes up and down, I can click on that on one police station, and maybe I can track that if you just scroll down a little bit. So this is the time of the day. This is one police station boundary, and this is the crime time of the day. You would see that between certain hours in a day, the crime actually peaks out. So this is the time when they need to deploy most police in the streets. And maybe this is just a criminal gang that becomes most active at that time. This is the time when the shopping malls are open and maybe more susceptible to that kind of crime, and so on and so forth. But this is then printed out in all these insights are then printed out in what we call a crime bulletin. These crime bulletins are printed on a weekly basis and then sent out to all the police stations for them to analyze and then change their policing patterns, change their deployments, change their patrolling patterns to prevent further crime from happening. So this is sort of a wide array of smartphone-based interventions that I've spoken about today, from tracking dengue epidemics to visits in health facilities, to pharmacies, visits to schools, tracking of vaccinators and spread of antigens so that they achieve a certain threshold, to tracking crime in the province. I'll stop here and wait for your questions to be asked. But before I finish, maybe one last thing before Zubair, I hand it over back to you. All of this is also powered by a platform that we've developed over time, which is what we call data plug. We could make bespoke applications for Android phones, and we've done several of these. But over time, we've learned that it makes most sense to develop a tool that lets you kind of drag and drop components and make an Android application. If we go back to a data plug, it's called data plug, and you can also use that platform. It's called dataplug.itu.edu.pk. I don't know if you can see this or not, but it's dataplug.itu.edu.pk. And if you go to that website and it'll take and say start using, it'll take you to a cell phone screen, and you can just add and remove components from this application. And this is sort of compiled automatically for you, so you don't need to write any line of code. You don't need to be a techie. It'll take you literally 5 minutes to make a data gathering Android application, and then you could download it and install it on your phone and give it out to lots of field workers. And if you wanted to change anything in the application, you need to come back to your login, log into this platform, make the changes, and all the cell phones that have this application installed would automatically get updated. So this is sort of a tool for us, from us, for the people to use. It's open source, free to use for everyone, for you to quickly assemble Android applications for field deployments. I'll stop here, and Zubair, you could moderate the question answer session.
Well, there are several. Thank you, Dr. Saif, for this very interesting, exciting presentation of the innovations you're leading in Government of Punjab. The interesting thing about this is the scale and the size. It's always easy to do small scale, interventions, but to you mentioned in the beginning, dealing with a province the size of 100 million citizens and the administration challenges and doing something interesting over there, that's the big challenges and very exciting work. Uh, has asked, what are you doing to educate citizens or the target audience of this open data and how to use it better?
Zubair, you're breaking up, but from what I can tell, I think your question concerns open data. We are beginning to now make more and more of our data public, starting with school education data, which I showed as part of this presentation also. The idea is to make unfiltered, unprocessed data, raw data, open to public, so they can see this data for themselves. And the next step is to make this data such that instead of just viewing this on a platform, they can register alerts around this data, so you can build sort of application logic around it. So for instance, if you see data.gov, which is US government's open data platform, it enables you to build applications on top of open data. So the first step was to enable citizens to come and dispute data about school education if they feel that the data does not accurately reflect reflect what's going on in the schools, the actual facilities in the schools. But the next step would be to make it accessible over an API, so that people can write applications around this data. The first application that we would hope people would build is when we open up our crime data. I've already shown you, that we're tracking crime in this province. People are actually reporting geotagged crime instances. As we open this data on an API, which means that whenever a crime is reported, alerts go out. I can easily foresee people building applications on top where they would organize neighborhood watches or start identifying crime clusters in their neighborhood. And if a crime like that gets reported, the community automatically gets mobilized. So for instance, imagine you parking your car in a parking lot and automatically getting an alert that 2 cars were stolen within this month from this parking lot. So you need to be very vigilant, and so on and so forth. So I think there are many exciting applications of making the data public and empowering the community to develop applications around that data, and also for journalists, for members in the civil society to use this data to put pressure on the government, wherever if they see crime trends going up, if they see school facilities or learning outcomes going down, and they keep getting alerts from this open data. They can start building application logic around that, and then start publishing stories in newspapers, and start building, sort of community pressure groups around, you know, around this evidence for the government to get its act together. So I think open data has that power, and it's important to use it in that aspect.
Uh, Graphs of registers, those things can probably be different. Are you thinking of moving towards metric-based attendance, schools and hospitals?
Yeah, Zubair, I can again hardly hear you, but here's my best guess at what you're trying to ask. I think you're trying to allude to an intervention for biometric attendance in schools and hospitals. See, so we have biometric attendance devices now deployed in all healthcare facilities in Punjab. About 800 biometric devices that are deployed in all healthcare facilities in Punjab. And even though out of the 19,000 medical officers, we're getting about 17,000 to mark attendance, the question is, even if they're in the hospital, are they doing their job? Are they just marking their attendance and then dissipating? And this becomes even more of a question for schools, where even if the teacher is present and you're ensuring their presence, are they teaching well or not? So therefore, I think the biometric attendance needs to be married with other systems, and one that we're exploring at this point is a speaker identification based system where they are automatically called out by the system on their cell phone. We can detect where their cell phone is at the time of the call, and then ask them to repeat certain pre-recorded phrases in their voice to ascertain that it is indeed the person that we've called is on the other line of the phone, and hence make sure that they are indeed in the school or in the hospital at any random time in the day. So they can do the biometric attendance, but what we really want is a system that randomly checks for their presence at a certain facility at any one point in time. This makes most sense for law enforcement agencies. There are lots of deployments in the field, and just the presence of the police officer brings down the crime. Not as much in hospitals and schools. In schools, the student learning outcome is the ultimate measure of whether this teacher is doing what he's supposed to do. In hospitals, the satisfaction of the patient is the ultimate measure. So I think just their presence alone doesn't quite address the service quality that we are after.
In the field, how do you get your data? And are you sure that the data quality you collect, let's say for school monitoring, is good?
So I think there are many ways to triangulate data. I think the important thing about data is, one, it needs to be in large numbers, so that no one can trick the data, game the data. If it's in large numbers, then it is typically reflective of what is going on. 2 million electronic reports filed through smartphones from schools, you can't game that kind of data. 7 million spot quizzes administered in schools, you can't game that kind of data. And two, it's important to triangulate data. So for instance, if we are measuring the attendance of medical officers, it's also important to measure how many patients were serviced in this hospital. It's also important to measure how much medicine was given out from the pharmacy to these patients. So it's important to triangulate the same data from different sources so you can ascertain that the data accurately reflects what is actually going on about the facility that you're trying to monitor. So why don't you ask me the question?
Yes. Irfan has asked that how do you, given the challenges with GPS, how can you transmit such big amounts of data within the Pakistani telecom infrastructure?
Well, Pakistan actually has good telecom infrastructure. So, for instance, compared to the US infrastructure, we have 3G deployed in Pakistan and 4G in some instances. Cell phone coverage is very good in Pakistan. And two, we do a fairly good job at compressing pictures. Textual data is easy to transmit, so we're very careful in what we transmit. So we compress images, uh, we we collect data that's largely textual in nature, largely form based, and we do a fairly good job, at compressing images and so on and so forth. Also, whatever doesn't get transmitted instantaneously gets stored on the device and gets uploaded whenever there's better connectivity. But Pakistan actually has a good cell phone coverage and good 3G coverage. So we've over time, this has gotten better, and we now rarely come across instances where we have challenges collecting data from the field.
One is that will you be outsourced? Do you plan to outsource
These you plan to continue to expand the size of e-government from the PITVs from in Punjab?
So several things that we outsource, and there are several things that we do in-house. One thing I've learned with the government is that you really have to keep at it. It's a very iterative process. We roll out technology, you invariably run into lots of on-static friction, lots of stakeholders, vested interests, etc., but also genuine problems of thousands of people wanting to use your technology, and little tweaks are always needed in making it work. So having an outsourced partner doesn't always work out, because the outsourced partners have a transactional contractual relationship, and are unwilling to go beyond it. Whereas if you're doing it all by yourself, you could keep tweaking and improving the system till it actually works. So I think so that's one. The other is that for problems that are well defined and they're off the shelf enterprise solutions, we typically outsource it and get that development on an enterprise platform. For instance, we are trying to introduce a case flow management system in Lahore High Court. That's a standardized case flow management system built on many platforms. In this case, this is a Siebel-based platform built on Oracle. It's developed by an outsourced partner who's done this in Singapore before, and is going to do a similar implementation here in Pakistan. So there's several systems that we outsource, many that we develop in-house, mostly because getting the government to use technology at scale is a highly iterative process, and is not it does not sit well with a transactional contractual relationship where the partner is not willing to go beyond it.
okay? I It's time to close, Dr. Saab. So I thank you on behalf of everyone for this very interesting presentation and answering our questions. And I thank participating and for all the questions. Thank you so much. And we look forward to seeing you in the next webinar session.
Thank you, Zubair. It's